Hi guys, welcome to my channel. My name is Dr. Sneha Chopra. Make sure to subscribe to my channel, hit that bell icon and also like if you really like this content. So today in this video I want to talk about sickle cell anemia and its management in terms of diet and how to lose weight if you have sickle cell anemia. So keep watching this video. So sickle cell anemia is a hereditary problem where the cell becomes sickle shaped. The RBC cells become sickle shaped, so the oxygen carrying capacity reduces. So it's very important that if you have sickle cell anemia or somebody with loved one has sickle cell anemia, how do you really manage the diet? How do you make sure that you're maintaining your weight? So generally sickle cell anemia patient, it comes with symptoms like joint ache, shortness of breath. So to make sure that you're suggesting a combination that really works for them. So number one, it's very important to know that you have to recommend the calories according to the requirement. Let's say for example, if their calorie requirement is 1500 calories. So generally in case of sickle cell patients, we make sure that we're suggesting at least 1.5x calories so that nutrients which are needed by the body is given in abundance and so that the absorption is better because the oxygen capacity for the body is less. So that's one thing. Number two, if you are designing a diet plan for someone who has sickle cell anemia and you want to make sure they also reduce weight, so definitely you have to create some form of calorie deficit. So the normal calorie deficit diet will not work here. So to make sure that from 1.5x you reduce a bit of calories and you try and reduce the calories from carbohydrates. Not a lot of carbohydrates, only 20%. The results of the weight loss is not going to be as fast. However, you're going to see amazing results probably month on month and not week on week. And when you are doing calorie deficit, make sure that you also take care of some very important micronutrients in the diet. What are these? Number one, you have to take care of vitamin C and vitamin E. So your diet should have vitamin E and vitamin C. These are the sources where you can take sources for food for vitamin C and vitamin E. Number two is you have to also make sure that you're taking enough folic acid because that really helps your cells to transport oxygen, and folic acid is essentially needed for somebody who's having sickle cell. So make sure these are the sources for folic acid and you take those and you include those in your diet as well. Number three is to make sure that they also have iron and zinc rich diet. These two micronutrients are very important to be able to maintain the right energy levels in the body. Otherwise the person is going to feel very lazy, lethargic, low on energy during the day. The energy levels have to go up. So zinc and iron are two most important micronutrients you have to really be careful of.